Good afternoon. This talk is dedicated to Dr. Drag Anders. He was my advisor for 5 years in this fine institution. I feel good to be here. And I brought for you a bouquet of roses. These roses come from Kenya. Kenya is one of the largest exporters of roses from Africa. They export over 200 varieties of roses. Here are these roses, harvested barely 48 hours ago, and they are here in full or partial bloom, ready to be consumed for their beauty and perfume. And you might ask, how did these roses get here so fresh? My answer would be information, communication, technology. And this is how it goes. The roses are harvested by 6 a.m. in the morning and soaked in chilling water for 6 hours. And then each rose is finely picked and analyzed for opening stage, color, bud size, stem strength, and the strength of the stem, and then put into uniform bunches. Each bunch is then given a number. That number is traceable from the farmhouses in Kenya all the way to the florists the world over. Once the boxes are numbered, they are loaded onto refrigerated trucks, and then the trucks leave for Jomo Kenyatta International Airport. And by 4 p.m., these flowers are in an aircraft headed for Amsterdam. They get to Amsterdam by 2 a.m. in the morning and quickly shuttle over to the Flora Holland Center in Aalsmeer. This is the largest floral auction house in the world. Over 45 million flowers are auctioned daily. The facility is the size of the city of Monaco, and people are connected around the world. Florists and brokers are connected around the world to this facility via the internet. And at 6 a.m., the buzzer goes off, and the bidding starts. The name of the flower shows up, the bud size, the color, the name of the grower, and if the price is right, you press a button, and the lot is cast. By 10 a.m., the frenzy is over, and 45 million flowers have been auctioned. Within 2 hours, these flowers are bound by truck, train, and airplane for the rest of Europe, Asia, and the United States, waiting for the expectant florist. And by the next morning, the gifting person has the fresh flowers. This has been described as a logistic miracle. Think about it. This logistic miracle results in flowers in a vase that wither away within 12 to 18 days. And if that distribution system breaks down on Valentine's Day or Mother's Day, women would lose the trust in the floral industry. The unfortunate reality is that, in as much as that would be breaking news, every day the distribution of essential drugs breaks down, and it's not breaking news. And you might ask me, how does that happen when the global pharmaceutical industry is 10,000 times the size of the floral industry? Whereby to this day, there are many mothers who walk into clinics and they're looking for one essential drug, and their babies don't have it. They die of treatable diseases. The reality is, amidst all the pomp and hype, technology transfer in the health sector is behind. Here's the story in Kenya. In Kenya, 80% of the population receives care from rural hospitals, from rural dispensaries and health centers. Those centers are supposed to receive drugs that are subsidized by the government, by the World Bank, the African Development Bank, by USAID, your tax dollars. And if everything goes right, those drugs will be available for free or at a low price. However, what happens is that those drugs are distributed on a 90 to 100-day cycle. 90 to 100, that's 4 times a year. So think about it. Coke, beer, SIM cards are distributed in these same villages every 7 days. We're talking about flowers from these same villages around the world daily. And it takes 100 to 90 days to get drugs. So what happens is that the health workers have to do everything they can to quantify and forecast the drugs they need for 90 days. I ask every one of you, if you were asked to quantify the groceries and supply for your house for the next 90 days, you'd say, Moka, I can't do it. That is overwhelming. And indeed it is. So what the health workers have to do, the nurses have to do, is they have a spreadsheet with 163 drugs and 9 columns of information: opening stock balance, closing stock balance, unit of measure, and so on and so forth. That is 1,440 calculations they have to do in order to be able to get the drugs they need. Your guess is as good as mine. By day 30, they are out of 30% of the drugs. By day 60, 75% are out of drugs. And by day 90, 2 drugs, paracetamol, if anything that can treat something at all. Now, put yourself in the shoes of that mother who wakes up at 5 o'clock in the morning with the baby on the back. The child has fevered all night. She comes to the clinic and she's given a prescription. At that moment, in that instance of disappointment, that mother has been asked to make a choice between whether she should buy milk for that baby, or buy seed, or buy fertilizer, or buy a SIM card, or maybe buy a pad for her school-age daughter to go to school. Our calculations are that over $33 million is shifted away from the homesteads of the poor towards this open market every year, and that is conservative. But then, unfortunately, the drugs in the open market are 3 to 5 times more expensive, and 40% are counterfeit. So, the reality is that the distribution system for essential drugs is broken. So, with that in mind, we know for sure that if every community has to survive, they have to better manage their scarce resources. And $33 million going to the open market is waste. It reminds me of an African fairy tale, the tale of the lion, the goat, and the banana, where the king wants to have a party and says, I need a lion, a goat, and a banana. And he calls the farmer, come here. The farmer comes and says, well, where do I get the goat, lion, and the banana from? He says, well, get it from the village across the river. Well, I have only a small canoe, and if I'm not careful, the lion will eat the goat, and if I'm not careful, the goat will eat the banana. And the king says, figure it out. So he figures it out. Anyway, he comes up with the formula as such. He's going to take the goat across first, and then come back for the banana, return with the banana, and then come back with the goat, and then take the lion. After all, the goat and the banana on the other side, the lion will eat the banana, and then would come back for the goat, and that's what he does. Now, as simple as that fairy tale may sound, it says that a fundamental function of every society is the fact that the distribution of the scarce resources must be carefully managed, and every profession must be part of that, healthcare included. So how is it that we have in a situation whereby there are drugs in the big hospitals and none in the large warehouses in the city like Nairobi, and none in the villages, in the dispensaries, where there are MRIs, CT scans, and X-ray machines, but there are many pregnant women or tuberculosis patients who have not seen an X-ray machine or an ultrasound in 2013. Folks, I'm here to say that technology transfer is an utter absurd phenomenon. That's insane. And with that, the result is the trust of many mothers with the modern healthcare system is broken. And that broken trust is worse than the broken trust of a mother expecting flowers on Mother's Day. And with the advent of mobile technology, we stand to be remembered as the generation, as the Facebooking, tweeting generation that did nothing about it. And I stood counted to be one of those amongst many who did something about it. That's why on October 11, 2011, I founded a company with a mission and a vision to take technology to the rural areas where 80% of people get care. When we presented our ideas and our projects to different funders and venture capitalists, we were told, oh, that idea is absurd and unsustainable. We were left with only the words of Albert Einstein that said, if at first your idea is not perceived as absurd, then there is no hope for it at all. And so we went to work and started developing. I'm glad to say that we have developed a technology that will work in a facility such as this. And you can see the number of dispensaries that can be served. The system is called ZD. ZD is an enterprise management system, all cloud-based, that allows us to track what is happening in every clinic, and we can monitor drugs remotely, and hopefully prevent the drugs from running out. And we now have Microsoft helping us develop a Windows 8 version. We're partnering to develop a Windows 8 version. And YASAT helping us connect each facility by spot beam satellite technology. The good news is that 2 weeks ago, we got a call from the Ministry of Health that said ZD would be the national e-health system in Kenya. And with this, each facility can be monitored for the drug supplies. And our promise is that if that is done, the shortage of drugs would be reduced. And a mother walking to the clinic would have her drugs and would be treated. And if that happens, hopefully that mother would one day be able to stop and smell the roses. To support our movement, #ZD, #Meliora. Thank you.